Hi there, everybody. Dr. Coletti with Cold Laser Protocols. Today I wanted to speak with you briefly about why cold laser protocols could not only affect your patients in your office and getting them out of pain quickly and effectively, but also helping your bottom line. And I wanted to share with you an analogy that I utilize often with my patients, regardless of what their problem is. Now, my practice happens to be broken into three different categories. I have my straight chiropractic patients, whether they're cash or managed care type patients. I have my personal injury side of my practice, which is, for those of you who are familiar, we treat patients in acute pain and accidents. And then thirdly, it's my cold laser protocol practice. So it's almost like I have three practices within my one roof. And for 18 years, I've been relatively, obviously, seemingly very successful in reducing all of my patients and getting them out of pain through mostly some physical therapy and chiropractic treatment and modalities. But when I came across cold laser and the effectiveness and efficiency, it reduces inflammation and swelling and regenerates tissue with patients, is bar none completely changed my entire practice, which is why I want to share this information and our protocols with you, because we can make a pretty strong statement in our own communities in being that cold laser guy or gal or specialist that can treat most of the people and get them out of pain that have been unsuccessful with injections, medications, or surgeries, or perhaps on that cusp of going to surgery. But the analogy I wanted to utilize is, if a patient, for example, comes in my office yesterday, 72-year-old woman, she was 72 years young. She had severe degeneration in her neck, and she had a pain level of 9 out of 10. Now, she'd already been to every physician that the injections, the medications. She's not a surgical candidate because she's got a heart condition as well, so nobody's going to put her under anesthesia and do surgery. And frankly, if you saw her x-rays, it was a nightmare, it was a mess. It was almost a 3-level fusion just from degeneration. Otherwise, though, looked in pretty good health. But the analogy I gave her was like, there's such a chronic inflammation and swelling there which causes all pain. And most techniques have not or been able to reduce that inflammation and flush that inflammation. So I like to utilize like a pipe. Like you got a pipe in your sink. It's got the U tube, the J or the U tube. And you put liquid Drano in there, and liquid Drano, you put it in there, and slowly, if you were looking at it, and we've all seen those commercials by liquid Drano, slowly kind of eats at that blockage, if you will. And when you pour the liquid Drano, you're supposed to let it sit for a while, and eventually it'll kind of chemically, or whatever you want to call it, which is really no different than cold laser, because it's reaching the patient and effectively pushing inflammation that's kind of just pooled there, and it stays there and it doesn't move. So that liquid Drano, it just kind of eventually, it's like stuff is seeping through, and then all of a sudden it flushes through the pipes, and now you can turn your water on. There's no clog, and it's like almost like a breath of fresh air. Oh my gosh, I feel better. That's kind of my analogy that I'll utilize with patients, is that you've had such a clog in that region, whether it's a neck, whether it's plantar fasciitis in your foot, or carpal tunnel in your wrists. It doesn't matter where the joint is that has a pooling of inflammation which causes that pain. The cold laser and our particular cold laser protocols will effectively break that clogging, if you will, that pooling of increased inflammation and blood flow, regardless of the degenerative level or the patient's age, and get them symptom free with, in essence, almost zero contraindications. I could go on and on, but you'll be hearing from me often. Again, my name is Dr. Coletti, and with Cold Laser Protocols coming to you very shortly. We are putting our final touches, and we'll be looking for people and doctors and offices and practices throughout the country who are interested. Please just fill out your information, leave it below, and we will start adding you to our list, because we will be accepting about 10 to 20 offices in different territories throughout the country as kind of a pilot physicians and utilizing and running through our protocols. So do not hesitate, leave your information. I look forward to working with each and every one of you to help not only your patients in your practice and your surrounding area, but also to help your bottom line and yourself and your practice and your families as well. I'm out, Dr. Coletti, take care.